I'm Dr. Fawad Mian. I'm a neurologist and regenerative medicine specialist. And today I'm going to talk to you a little bit about why I went into neurology as well as regenerative medicine. So one of the main reasons why I went into medicine in the first place is because I felt very fascinated by it, but also because I really wanted to try to help people, which I know sounds very cliche-ish. Originally, my dad was a paint contractor, and whenever he worked with wood, he would also come home with splinters in his hands. I would always try to get them out and try to make him feel better. I wanted to get him out of pain. As time went along, I felt that that was actually my calling with medicine. So originally, I was very interested in neurology, and during my rotations, I would often see patients that were very debilitated, for instance, with strokes, who would get significantly better, or those folks who wouldn't get much better at all. But I was very fascinated by not only neuroanatomy, but just how it relates to the body as well. In neurology, I also see a lot of patients with such issues as migraines, neck pain, back pain, knee pain, shoulder pain. A lot of times they are referred to neurologists for these kinds of issues, which are thought to be neurological. As time went along, I found out that these issues were more musculoskeletal and really needed to be addressed. However, they weren't being addressed quite as well as I'd like them to be. Typically, these patients were sent from orthopedic doctors, from pain management specialists, and these patients simply weren't getting any better. So, thinking back to how things were when I originally started with my thought of being in medicine and helping people, getting them out of pain, I tried to find ways to get these patients out of pain. With the training that I received, obviously, we go along with traditional Western medicine in terms of medications, physical therapy, acupuncture, sending people to pain management. And at times, sometimes these things can simply work. Physical therapy can work great if the issues are typically minor. Pain management might help if the issues are not as acute as we think they are. A lot of times people have issues that have gone on for a long period of time and then become very difficult to treat. I found out that over time, even though I could get a lot of patients better with the typical things I would do, there was still a large subset of patients that I just could not get better. And I needed to find a better way of making them feel better. Along the same time, I was having issues with my own body. In particular, I had an Achilles issue. And this is something that had plagued me for over 5 to 6 years, and it was getting progressively worse. I tried conservative treatments just like everybody else, just like you. But at the end of the day, the foot doctor told me, you know what, we're probably gonna have to shave down this bone. Now, I don't know about you, but I've had plenty of surgeries that I've had in the past that have not gone so well. I've had knee surgery, I've had jaw surgery, I've had other surgeries. And one thing I can tell you is that when you have surgery, it's hard to go back to how things were prior to the surgery. And sometimes the surgeries just don't work at all. I actually had a ACL repair back in 2001. And when I was starting to have a little bit of knee pain back in 2013, I did an MRI, and lo and behold, the ACL was not there. So the surgery essentially failed. I remember the recovery, and I remember how difficult, how painful the whole thing was. It's amazing that I went through all of that, and I had nothing really to show for it, and my knee was still a bit unstable. So surgeries essentially don't always work all the time. But in the case of my Achilles, I tried to find other ways of trying to help heal it. And that's actually when I went into prolotherapy as well as regenerative medicine. So what prolotherapy is, in a nutshell, is that we're trying to help heal the ligaments, we're trying to help heal the tendon, we're trying to help heal cartilage. And so when we deposit this solution into the areas that are affected, I've seen patients, including myself, significant improvements in terms of how they feel. One of the other treatments that we do is actually platelet-rich plasma, where we take your own blood, we spin it down, we get the growth factors out, and we put it back into the affected joints, tendons, ligaments, and cartilage. And I've seen some great results with patients. I had one patient that came in who was told that he too needed surgery. He went to 3 different orthopedic surgeons and he didn't get any better. He was very skeptical coming to me because a lot of the stuff is not traditional mainstream medicine. However, when we did PRP into his hip, he was 80% better after about 6 weeks. So he came back for the second shot, and after that, he was completely fine. So in this case, we were actually able to save this individual from having a surgery that may have led to more surgeries down the line. And that's essentially what I'm trying to do, and one of my missions in medicine at this point is not only get people out of pain like I did with my dad when I was much younger, but also to get them feeling better so that they can get back into the game of life, so that they don't have to be weighed down by living in chronic pain and living their life around pain. These treatments are life-changing for a lot of people. It's been life-changing for me. It's been life-changing for some family members too as well. These are treatments that are very safe and effective. In fact, over 90% of people who get this treatment are significantly better, and a lot of people's issues are essentially cured at that point. Surgery is not always the answer to everything. There are studies that show that these treatments work incredibly well. There was a recent study done in Wisconsin in regards to knee pain, and they compared different types of treatments, and they found out with just regular prolotherapy that their knee pain and their pain was significantly improved just by doing this, as opposed to going through surgery and other modalities of treatment. Now, we've all tried physical therapy, we've all tried going to pain management, orthopedic doctors, but sometimes things just don't work out the way that we want them to, and these are the treatments that can help get you to the point where you can go out and be active again. So if you have any questions about this, or you feel like this is something that you would like to do, please give our office a call at 973-928-3288 to schedule a consultation. You can also find out more information by going onto our website at PasakeSleepNeuro.com. Thank you.